Hi everyone, welcome back to my YouTube channel, and today we are going to talk about movements of mandible. So let's start our topic with introduction. Mandible is the only movable bone of the skull excluding the ossicles that forms the lower jaw. It moves the temporomandibular joint, which are bilateral synovial joint between the condylar process of mandible and mandibular fossa of temporal bones. These movements are essential for mastication, speech, swallowing, and facial expressions. Mandible is capable of hinge movement, that is rotational movement, and gliding movement, that is translational movements, due to its unique structure of TMJ. Types of mandibular movement. It includes depression, that is opening of the mouth, elevation, that is closing of the mouth, protrusion, that is protraction of the mouth, retrusion, that is retraction, and lateral movements, that are side to side grinding movements of the mouth. First, we will talk about depression, that is opening of the mandible or opening of the mouth. Definition. This is basically downward movement of the mandible that lowers the jaw and opens the mouth. Joint mechanics involved in this is: first, there is initial hinge movement at the lower compartment of temporomandibular joint, that is followed by gliding movement of the condyle and disc in the upper compartment, and this is how depression of or opening of the mouth is done. Muscle involved in depression include lateral pterygoid muscles, that is main muscle that pull the disc and condyle forward. Second muscle is digastric muscle, in which anterior belly is involved in case of depression, and geniohyoid muscle and mylohyoid muscle, they assist depression by lowering the mandible. Third is gravity, that also assists this movement of depression. Second type of mandibular movement is elevation, that is closing of the mouth. It is upward movement of the mandible to close the mouth. Joint mechanics in this is reverse of depression, that involves hinge and gliding movements. Muscle involved in elevation include masseter muscle, that is powerful elevator of mandible. Second is temporalis muscle, especially the anterior fibers of temporalis muscle help in elevation of the mandible. Then there is medial pterygoid muscle that work with masseter to elevate the mandible. Third type of mandibular movement is protrusion or protraction. It is forward movement of the mandible so that the lower teeth move anteriorly beyond the upper teeth. Joint mechanics is that it occurs mainly in the upper compartment of temporomandibular joint through gliding movement. Muscle involved in protrusion movement include lateral pterygoid muscle, that is primary muscle for protrusion. Second muscle is medial pterygoid muscle that assists lateral pterygoid muscle in protrusion. Fourth type of movement is retrusion movement, that is also called as retraction. It is backward movement of the mandible to return it to its normal position after protrusion. It is mechanics in this is gliding in the upper compartment, same as protrusion but in reverse direction. Muscle involved in retrusion movement include posterior fibers of temporalis that are main retractor muscles of mandible. Second, it includes digastric and geniohyoid muscle that assist temporalis muscle in retrusion. Further movement include lateral movements that are also called as side-to-side grinding movements of the mandible. It is alternate movement of mandible to the left and right side that is essential for grinding food. Joint mechanics in this include one condyle that rotates around a vertical axis in the lower compartment, and the opposite condyle that glides forward in the upper compartment, and this movement continue one by one. Alternatively, we can say. Muscle involved in this movement include lateral pterygoid muscle of one side that pulls the condyle forward, while the opposite side condyle acts as a pivot. And medial pterygoid muscle assists in this movement, and this is combination of rotation on one side and translation on other side movement. As in one side there is rotation movement, and on the contralateral side or opposite side there is gliding movement, and both of the first rotation movement occur in lower compartment, and the gliding movement occurs in upper compartment in this case. Summary of movements. First is depression, that is done by lateral pterygoid muscle digastric muscle, geniohyoid muscle, and mylohyoid muscle. Second movement is elevation, that is accomplished by masseter muscle, temporalis muscle, and medial pterygoid muscle. Third movement is protrusion movement, that is accomplished by lateral pterygoid muscle, and medial pterygoid muscle assist in this. Fourth movement is retrusion movement, which is done or accomplished by posterior temporalis muscle, digastric muscle, and geniohyoid muscle. Fifth movement is lateral movement, that is done by lateral and medial pterygoid muscle alternatively. Functional significance of mandible movement. First is mastication. These coordinated movements allow biting, tearing, and grinding of the foods. Second function is speech. This precise mandibular positioning is vital for articulation, and that is important for speech. Third significance is swallowing, as mandibular depression and elevation facilitate oral phases of swallowing. Fourth significance is facial expression, as movements of the mandible affect expression like smiling, frowning, and speaking. Conclusion of this lecture video. Mandible performs a complex combination of rotational and translational movements at the TMJ that are controlled by a group of strong muscles. Understanding these movements is essential in dentistry, maxillofacial surgery, speech therapy, and diagnosis of TMJ disorders. And this was all about mandibular movements. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.